Hi everyone, Dr. Jeff back with you this week with Corpus and Alyssa. Hope everybody's enjoying our videos because we certainly enjoy doing them for you. And I know this week we've got a very common and often asked question. What are we talking about this week?
So this week we're actually talking about rotator cuff injuries, more specifically a torn supraspinatus. So your rotator cuff is a group of 4 muscles that is attached to your shoulder blade and helps keep it in place and keep your arm moving. So your supraspinatus can be torn either fully or partially.
So causes of supraspinatus tendinitis is trauma, and what I've seen in the office is this time of year you slip on ice and your arm goes flying up in the air, and that can damage your rotator cuff and your supraspinatus. Also falling on your shoulder, skiing, snowboarding, slipping, falling on your shoulder, even sleeping on your shoulder. I've seen that happen as well. Most commonly though is going to be an overuse type of injuries. This is mostly seen with people that do a lot of overuse, overhead action, so badminton players, tennis players, squash players, baseball pitchers, anybody that works over their head on a regular basis, drywallers, things like that. That's one way they can overuse their supraspinatus, and all you gotta do is throw a ball, and all of a sudden your arm falls off, and you got a supraspinatus tear.
Yeah, so with a supraspinatus tear, you're gonna have kind of a constant dull, achy pain right at the front of your shoulder here. And then you're gonna have something what we call a painful arc. So as you're moving kind of through your range of motion, it's gonna feel that dull pain. And as soon as you hit a certain point, it's gonna be a really sharp, not too comfortable pain. And then kind of once you move past that arc, it'll be the normal pain that you feel. Another thing is, like Jeff said, weakness. So when you go to throw that ball, you won't be very successful and it won't go very far. Another thing is a pain when you're kind of doing your daily activities like shampooing or brushing your hair. It'll really hurt your shoulder.
So in order to diagnose this type of injury, generally you have to come in and we do some orthopedic tests. We have to differentiate between other types of shoulder injuries such as an impingement syndrome, dislocation, separation, tendonitis, calcific tendonitis, things like that. So certain tests we do to try and differentiate, diagnose what exactly on the shoulder is so we know what we have to do to treat it.
If we need a way to confirm our diagnosis, we can send you off to do an ultrasound or an MRI to kind of understand what's going on within that shoulder. Now, to treat something like this, we usually start off with a conservative approach. So something like shockwave therapy, laser. We're also going to prescribe you some exercises to kind of strengthen those muscles, as well as some soft tissue therapies, so something like ART or massage.
If we're not getting better, shoulders do take a long time to get better, so patience is the virtue here. But if it's not going according to plan, we can always refer you out to see the orthopedic surgeon. Surgeons don't generally like to operate on shoulders, whether it's a full length tear or a partial length tear. One of the reasons is because generally when they're finished operating on you, you really don't get your range of motion back, you really don't get your strength back. One of the only reasons they will operate on this is for pain. So for some reason the pain is keeping you at night, we can't function, you can't do things, we can't get the pain down. That's when a surgeon may offer you the option of doing some surgery on it.
Yeah, so if you're feeling shoulder pain, or more specifically that kind of, you think it's a super tear, feel free to come on in and we can diagnose that shoulder pain for you. Other than that, that is all we have for you guys. Feel free to comment something down below as what you want to see next or any questions, as well as leave a like. And as always, here at Goldsworthy Wellness, we got your back.